This may be a slightly longer video today, but worth watching through to the end because we're going to give you some helpful information about the most common inquiry you get, which is when someone's lower back has gone out or they've developed acute and severe lower back pain and spasm or sciatica down their leg. The first thing we'd always reassure people is nothing has gone out of place and there's usually no damage to the structures of your lower back. What has usually happened is that you've got an acute or a slow build-up of overload to your lower back, hips or pelvis, and that has caused a sudden inflammation and spasm response that's responsible for this severe pain. And we completely understand and sympathise that it's a really distressing and worrying situation when you feel like you physically can't move from a pain. What we do suggest you do though is treat it like any other sprain strain situation that you might encounter, which is to make the number one priority getting swelling or inflammation reduced, which is often at the heart of why there's so much spasm. To do that, first thing we recommend you do is get an ice pack, wrap it in a damp tea towel or cloth, and pop it over the base of your lower back for 10 to 15 minutes at a time. You can also, if it's okay for you to take them, over-the-counter anti-inflammatories like ibuprofen, combined with normal pain relief as well to try and help bring the pain levels down. The other thing we'd always suggest you do, if you can, is to try and move and keep changing positions regularly, just to try and get some movement into the area. A simple self-help technique is to try and find, relatively speaking, the most tolerable direction of movement, no matter which one that is, and just perform gentle repeats of that tolerable movement regularly through the day. Your chiropractor or physiotherapist can be a great port of call for advice and indeed treatment if it's going to be helpful. We'd usually recommend ringing in or emailing in first because we might not always recommend you come in for these types of issues, or at least not straight away. We might be happy to give you some of this advice to do at home for the first 24, 48 hours to try and allow things to settle. What we don't recommend you do is to go to A&E usually. Now, hardly ever does go to our A&E result in any investigations or actions or treatment. The only time we recommend people to go to A&E is when they've answered yes to a routine set of screening questions that we would always ask about quad equina syndrome. Now, we've attached a link to this video which outlines some symptoms that we need to look out for whenever there's severe lower back pain. We will ask you some routine questions about the function and sensation of your bowel and bladder, your saddle area and your genitals, just to make sure that these nerves from the lower back are working properly, and ruling out quad equina, which is when there's an acute pressure or swelling affecting the function of the nerves from the lower back in that way. And that's the only time that getting to A&E as quick as possible is important. If you have any questions from the information today or you'd like some advice, please don't hesitate to get in touch, and we look forward to helping you soon.